Hey folks, Dr. Bret Brennan here with Healthy Feet Podiatry. Today we're going to be talking about the surgical correction of hammertoes. We're going to cover what hammertoes are, how I fix them, and when you can get back to your normal life activities after your procedure. So what a hammertoe is it's an angulation deformity of the joint of the toe, which is caused by this green muscle here gaining an advantage over the orange muscle. What happens when that occurs is it pulls the toe up into this position. This can create painful calluses on the top of the toe, which then significantly affect a patient's life. So we're going to move over to the next picture here, and I'm going to show you how I fix it. So you can see these two dotted lines, and what they are is bone cuts through the bone to allow me my reduction of this joint here. Also, you see this staggered green line. In order to get to the bone, I have to make a cut through the muscle, which I do to lengthen that muscle on the top of the toe, which allows the toe to relax down into a straight position. After these bones are cut, I use some sort of internal fixation. It changes per the patient to hold that bone in place. Everything is sutured back up and you're back to life. So that brings me to the when. When can we weight bear after our procedure? To some extent, it depends on what kind of hardware I use in the joint. However, typically you can weight bear at least on your heel the first day of your procedure. When can you return the shoes? Again, this is a little bit dependent on the hardware. However, for I would say about 95% of the procedures, you can return back to your shoe gear in 4 weeks. And as with any podiatric procedure, we suggest orthotics after surgery to prevent the recurrence of the deformity and to support our procedure from the outside. If you have any questions or you feel like you may be a candidate for hammertoe surgery, give us a call. And also in the comment section below, leave us some suggestions for some videos that you would like to see. Thanks.